Portion of Daytime Tri-Cities is sponsored by ProCompounding Pharmacy.
Well, in this month's Living Well, we want to talk about a medicine that was originally developed to help prevent relapse into alcohol or drug abuse. It's called Naltrexone. Here with more now, Jessica Patrone, president and owner of ProCompounding. She's going to give us some important information. Always good to have you back. I always learn so much during these segments.
Well, I hope everybody does. But yeah, the topic is going to be about naltrexone today, and not so much naltrexone as it was originally designed to be used for opioid dependence, but low-dose naltrexone. So there's a lot of other uses, and I'll give you a little bit of history about the drug first. So originally, like I said, it was used for opioid or alcohol dependence, and then in the mid-'80s, a doctor out of New York discovered that we could use really low doses of naltrexone, so like a 10th or a 20th of the normally prescribed dose, to help treat immune disorders. And you kind of think, like, what does one have to do with the other? Well, there's actually opioid receptors, not just in the brain, but also on white blood cells. So we all know how important white blood cells are with immune function. So low-dose naltrexone can help with a lot of symptoms like reduction in inflammation, pain sensitivity, chronic fatigue. There's even mood disorders. There's a lot of different potential uses for low-dose naltrexone. So, you know, as science has kind of, taken this, they've been able to treat a lot of immune disorders and things beyond just immune disorders. So you think fibromyalgia, multiple sclerosis, psoriasis, lupus, chronic fatigue syndrome. We're even seeing some use of the drug in long-haul COVID, although the jury's probably still out on that. It's more for the fatigue component of it. So yeah,
and so you're compounding. You said that's the way that it comes. That's the way you.
Yeah. So it's got to be compounded. Okay. The commercially available product is in the really high dose. Okay. So it's got to be compounded down to a very low dose, and that's very specific to the patient. So some patients may only require 1.5 milligrams. Some would require 4.5. So basically, what we do is we titrate that dose. We start patients real low, and we titrate the dose up so that we can upregulate, and this is going to sound really technical, but upregulate the opioid receptor on the T cell. Okay, so it's very specific to each patient, and because of that, everybody's dose is different, and that's where compounding comes in. That's where ProCompounding can help.
So the reaction from some of the patients who've been on this, because I would imagine when they were first learning about it and you're explaining it, it's like, wait, what? And then when they understand, they start using it in these low doses, what kind of a response have you gotten?
It can be life-changing for some patients. So particularly from the inflammation perspective, and chronic fatigue as well. People who just can't get out of bed because of chronic fatigue. I mean, we're not talking about depression or anything, but it's even been used in some mood disorders, and it's even been used in autism. So there's a lot of research out there and a lot of uses, and that just goes back to kind of the general science. I mean, we typically will think of a drug having one purpose, but there's receptors in our body that are all over the place. So there's a lot of things that can be used in different ways, and naltrexone's one of them.
So powerful.
It can be life-changing.
I love when you join us, and that is why. All right, we're going to give everybody some information. If you have questions or you want to learn more about this particular medication and how they're using it there at ProCompounding Pharmacy, you can do so by checking out their website, ProCompounding.com, or you can give Jessica a call there at the number of your screen. And of course, they're located right there off North State of Franklin Road. Thanks for joining us.
Thanks, my pleasure.
The preceding portion of Daytime Tri-Cities was sponsored by ProCompounding Pharmacy.